Hello again, Ash, and welcome to the next part of our mini podcast. Today we're chatting about nausea and vomiting. This can be caused by a treatment or the cancer itself. The doctor prescribes medicines called antiemetics to help with nausea and vomiting, which is important to take as prescribed. Often there are triggers for nausea though, which include food smells, gas in the stomach, motion sickness, stress at the thought of having treatment. So Ash, what nutritional tips do you suggest?
Hi Kathleen, good to be back. In regards to nausea, we have a few things we can try. Again, smaller frequent meals is a great way to make sure food doesn't become too overwhelming. Often going without food for long periods of time can actually make your nausea worse, so try to have something small more often. You can try bland or dry foods. They can help with that nauseous feeling. So things like crackers, toast, or dry cereals even. To help with nausea triggers such as smell, one of the best ways I've found in practice is to have cold foods or foods at room temperature. Simply just not warming your meal up can stop those powerful smells. You could try things like sandwiches, wraps, salads, canned and tinned fruit, or jelly even. Now, there are some heavier options, but you can try puddings such as creamed rice, custard, mousse, or even yogurt if tolerated. But please be aware that fatty, spicy, and sweet foods may cause more nausea. If you are cooking, try to make plain protein-rich meals. Preparing those room temperature meals like sandwiches and wraps also works really well if you're struggling with cooking smells. And on days when you are feeling a bit better, try cooking in bulk and freeze some portions away. Please make sure we're keeping food safety in mind if you're not freezing foods away, and anything left in the fridge shouldn't be left for more than a few days. Finally, a great way we can help with nausea is to have something with ginger in it. So research has actually shown that ginger does have anti-nausea properties and can assist with symptom management. Having some ginger tea, a ginger biscuit, or even some non-alcoholic ginger beer are great options to try. There is also some evidence suggesting that peppermint may help with nausea. Some examples of what we can use for this are things like peppermint extract in water. You can try peppermint oil aromatherapy, or even just sucking on a peppermint may help. Just please be aware that if you've been prescribed medication, you really shouldn't be swapping that out for either ginger or peppermint. These are complementary therapies, meaning we use them in conjunction with our medication. Again, any questions, please chat to your healthcare team.
Great advice and tips. Thanks, Ash. I know in my nursing career I've often used ginger tea or peppermint tea to help patients out. And what about vomiting? How can people best deal with that?
That's a great question as well. So vomiting, especially if excessive, can be really dangerous, Kathleen. So first thing to note is that if your vomiting lasts more than 24 hours or you can't keep fluids down, please go see your doctor as dehydration becomes a big risk factor. With that in mind, I think taking sips of fluids as much as you can is a great way you can deal with this. We can try things like our flat ginger ale or maybe a wheat cordial. Some hydrolyte or gastrolyte are other good options to keep you hydrated. Now, once the vomiting has stopped, small amounts of some of those dry foods we mentioned before can be helpful. Things like the crackers or dry toast. Then what you want to do is slowly increase the amount of food you're having until you're back at your normal amount. What you need to keep in mind is that you take your time and focus on hydration. Sometimes nourishing liquids, and by nourishing liquids we mean things such as milk or watered down fruit drinks, can actually help people transition from fluids to solids.
Thanks, Ash. And that brings us to the end of today's episode. If you would like more information, Cancer Council New South Wales, the Thing About Cancer series podcast on appetite loss and nausea, which has some additional information, can be found on their website. Always remember to talk to your healthcare team for specialised advice. Look forward to chatting to you next time. Bye.